I think we're live. Welcome back to Sunday night, everybody. I'm Dr. Boz, and I am trying to make a habit of posting every Sunday when I start my fast and put out a live video, which each week should get easier, but I think it gets scarier, to make sure that I can answer a lot of the questions that have come in throughout the week, and then just give support to the people who have faithfully dialed in despite my beginningness to all this. Again, I'm Dr. Boz. I wrote a book named Any Way You Can, and the book has been fantastic for my practice. I'm an internal medicine physician, and that just means I'm in the long game. We start at puberty and we take them to the grave. We are in the long chronic disease management. And a couple of years ago, my mother had a heck of a time with life, decided she might just want to throw in the towel, and nearly did. But in the midst of this, I challenged her by saying, here's what I would do in the midst of a very difficult 71-year-old body filled with cancer and filled with fatigue and filled with inflammation. That's where the story in the book starts. It takes you through her journey, and has just been very rewarding. I wrote it as notes for my mom when she was going through this difficult time, and thanks to my husband's encouragement, I actually wrote in the science behind what I was teaching her, and then turned it into a book. The book, Any Way You Can, sold on Amazon. Direct publishing is amazing, actually. All right, so today I have a couple of updates. The first thing I like to do is say, why in the world do I use the F word? Why do I fast? And I didn't used to. I don't think I missed a meal until about 2 years ago maybe. And then it was well into my ketogenic journey that before I missed a meal. Fasting was something that wasn't in our culture and wasn't in where I was from. So tonight, if you're watching, there's a couple of things that I would like you to just cheer in for. I love knowing where you're from. It really is impressive how big my classroom has become, which is why I've tried to add a little something I'm going to do tonight. I gave a big workshop a couple of weeks ago. It's a 7-hour workshop on brains of addiction, and that's one of my favorite things to teach about. I got a lot of feedback saying, what do you teach in that? And so I'm going to use some of the slides from that tonight just to drive home a point. But when looking at fasting, I would like you to also post if you've ever tried to fast, because I think it's a really brave thing, and I do it as a accountability to my patients. When they get sick enough that I say the word fasting, they think it's crazy. Like, who does that? That's like meant for people out of desperation. And I would contend a lot of them are desperate when they've been struggling with these health problems for so long. And fasting does some unbelievable improvements in their inflammation and healing the body. It's just not very conventional. So each week I try to say, I start on Sunday, and sometimes I do 12 hours and I can't do it. It's not in it. So I've learned that if I really want to make it a 48-hour fast or maybe a 72-hour fast, that I have to have a really good why in my heart. So a few weeks ago, I was talking about a patient or a friend of mine at church who had esophageal cancer, and then the next couple weeks at church he was missing. I had fasted in his name and in his honor to just say, gosh, that's a tough journey. He's had a tough go of it. He's been missing from church ever since. And this past week I went to visit him at the hospital, and indeed he is struggling. Esophageal cancer it's hard, and his body's been filled with inflammation for a long time. You know, changing all those habits right at the end, if your daughter's not an internal medicine doctor and gonna just put on the bootstraps and do it with you, it's really hard. So I'd given him a copy of my book, but it's not something he can handle right now. He's in a really tough chapter, so I'm going to continue to pray for him. I'm actually going to be selfish this week, and the reason I'm fasting this week is for me. There's a really big choice point in my life on Tuesday, so I am going to use my own journey as the reason I'm fasting. So if you're fasting this week, I know I'll make it through Thursday because this is a big deal for me. Or not through Thursday, good Lord. 48 hours is plenty. But I'll make it through Tuesday. And if you want to join me, I would love to hear where you're from today, and then if you've ever fasted, and if you haven't, it's okay if you haven't. I didn't do it for a long time. So you'll see these pictures behind me. I want to use tonight to do some education. I've had this past week where Thanksgiving is real. Thanksgiving has lots of carbs in it. So I traveled to the family farm, and my family and my sister's family and our kids and our husbands and my mom and dad were all there. And yeah, we had plenty of carbs at the table. It's just one of those holiday days where we said, you know, we'll prepare after and we'll prepare during, but it's probably going to be a carb week. And sure indeed, there were plenty of carbohydrates on Thursday. And it was interesting to watch my mom, who's now 74 and currently under chemotherapy. And one of the problems with her cancer, she has lots of lymph cells throughout her body. And whenever lymph cells die, the uric acid that's there also becomes part of your bloodstream. So it's really easy to see a flare in the gout that can happen during cancer. So she knows when she has increased inflammation that the gout symptoms come back for her. So I called her today and said, how are you feeling? And she's like, boy, those carbs got to me. And I said, what were your symptoms? And she has, you know, swollen fingers, swollen hands. And, you know, we've got some strategies of how to help her throughout the week, but 74 years old and can't quite make a fist. And the swelling is so hard. And it's gone when she stays in ketosis. But boy, her body's too fragile to put that many carbs in. And, you know, you kind of forget how much it affects you until you've been really good, and then you're not. But I'm using this story to tell you that the reason I stayed keto was that my brain is the reason I stayed keto. I take care of a lot of brains in my clinic. I think of my patients as, if you want to take care of chronic illness, I don't care if it's diabetes, obesity, cancer, if their brain's not working, if they're depressed, if they're not sleeping well, you're gonna struggle to improve them. So the reason I first started studying the ketogenic diet was the seizure patients that were kids who kind of, they didn't qualify or they didn't respond well to the medications for children's seizures, and they got put on a ketogenic diet. And sure enough, that worked great. And that was, you know, many years ago, and they are now dying. And the autopsies for these patients who've had seizures, their brains should look awful. Like, I'm going to show you some pictures here, and I'll say, if I didn't know better, I'd think that was a seizure patient. Because their brains, the circuits are difficult, the conduction is swollen. Think of it as lots of wires with water. It's not quite how it is, but lots of inflammation with seizures. And boy, I've learned if you don't want to have a seizure brain as you age. But these autopsies of these kids who had childhood seizures, who'd been on a ketogenic diet for life, they had pristine brains. I had brain envy, and that's what first got me saying, I need to learn about this. There has to be something more to this. That's amazing. That isn't how we would expect it. So when I first got on the ketogenic diet, I loved how I felt like my brain was back to being a 20-year-old brain where I could focus for hours. I could write a book, which I probably couldn't have done if I wasn't in a ketogenic state, meaning I could concentrate so much better. Not only was weight loss part of it, but the brain function has really been amazing. So when Thursday came for me and I took in too many carbohydrates, and you know, the next day I was definitely irritable. If the first symptom for me that goes haywire when I'm not in a ketogenic state is I feel my brain, I get a little headache, I get irritable, I'm moody, I snap at my kids more, and it takes 2 or 3 days for me to kind of get back out of that funk. Of course, a fast does that really well. But today in church, I had another person come up to me and say, you know, do you think the ketogenic diet is a good diet for Alzheimer's? And I write about that in the book, saying absolutely. We know that an Alzheimer's brain is known as the third type 3 diabetes. It's due to high sugars. And I'm going to use some of the slides. I took the little course from Dr. Amen and have been an advocate of his education and his SPECT Scan teaching, because I think it does a great job of teaching when our brains don't function very well, what does that look like, and can we learn from that? So I thought I'd use these slides to just see if we could I could teach from this. So this is a picture of a SPECT scan, and if you look wherever you see pink, pink means eyeballs. So this picture we're looking down on the brain. This picture we're looking, the patient's looking towards like this direction. This one, we've got the brain up and you're looking at it from the underside. And this one is looking at it this way. There's a little bit of pink right there. You can't probably see it there. But these are just pictures of normal. And what you'll see is there's not very many holes. There's nice smooth pictures without defects. If you look at this slide, it's an example of what happens to brains as they age. Here's a nice, healthy, normal brain. But then as you get into your 30s, 40s, and 50s, there's some little divots. And those get bigger as our brains age even further. This is one of the symptoms of chronic swelling on the brain. And we know that everything from Parkinson's to bipolar to depression to Alzheimer's all have brains that get chronic swelling in them, and that swelling doesn't get reset. So just to kind of give you some more education, this is a picture of, again, a normal healthy brain. And this one had a baseball to the right front part of their brain. I think it was over 6 months ago. So the brain has still not kind of woke up again. If you went to autopsy for this patient, you'd see the brain tissue is still there. It's just not conducting the messages the way it's supposed to. It's kind of offline, and that's from a baseball to the head. So traumatic brain injury. Here's some 60-year-old brains, and one of the things Dr. Amann talks about when he you go through his class is the brain you have today is not the brain you need. And I think, I'm sorry, on one of these, it's going to be backwards, so pretend the words aren't there. I'm sorry. I know there's probably a million better ways to teach you this and do these slides, but this was easy for me. So these are all 60-year-old brains, and this one's nice and healthy. This is a patient who has sleep apnea and refuses to wear their CPAP machine. Just incredible sized holes that are offline, and they wonder why the depression is hard and their immune system is just one of the parts of their body that's chronically swollen. And then this is an Alzheimer's patient. I just want you to take a look at that, because that's going to be what I talk about today at church. I had someone ask me if this was the right plan, but I wanted to use these slides to say, guess what else does this to your brain? This is a 37-year-old male who is a chronic drinker. Didn't start till heavy drinking of alcohol till about 10 years ago, but much like alcohol, or much like brain trauma, when you get a punch to the head, when you get brain trauma, the brain swells. And alcohol also swells the brain. You get chronic swelling and it goes offline and it doesn't turn back on very well. So this guy, 37 years old, really incredibly damaged brain because of the chronic alcohol. You can't fix that until you get good sleep, and I contend you can't get good sleep until you're off the alcohol, so kind of stuck. I think this tells quite an interesting pattern too. Might need to back up the camera there a little bit. This is a diabetic, and when I show this to people, they really have kind of a perplexed, like, how can that be? Look at the holes that are in the brain. This is a 41-year-old with diabetes. And they didn't get diabetes till they were in their early 30s. They've got a nice big round tummy, they've been overweight, and they think, well, that doesn't cause brain problems. I mean, my sugars are fine. I mean, I think my sugars are like 120. And I'm like, yeah, but if you want a healthy brain, we need to do way better than that. And I think that's the point, that when you hear about Alzheimer's being a type 3 diabetes, which is this chronic, long-term high blood sugars for the better part of 3 decades, and then a time where it's not getting that healthy flush of anti-inflammatory because of the chronic swelling, it gives you a little bit of understanding to say, how can high blood sugars lead to Alzheimer's? And where is the connection? Why do people with alcohol have a higher rate of Alzheimer's? And what I'm trying to show you with these slides is they all have one problem, which is chronic long-term swelling. Let me just give you a couple more just for context. This is a really powerful picture. Let's see if I can pull that in a little. And that is a brain of a 29-year-old woman who had anorexia. And, again, 2 major problems there. One being that she has malnourishment, but the other being that she has mental health issues. And boy, you put those 2 in combination, and it's a tough life. I mean, that brain is incredibly damaged, and she's 29 years old. And so when they would come to me as patients, and knowing what you know about the brain diseases, you want them to say, oh my goodness, this is fixable. The brain you have today is not the one you have to have. but you got to do some, you got to help me. You got to help me help you. I can't give you a medicine that's going to reverse all that. This is about a life that gets 8 hours of sleep. This is about a blood sugar that's normal. Not, it's pretty good. I got a 120. No, 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 no. We're talking about brain problems here. So this was the story I was trying to tell the gal at church. And this is a woman named Nancy. And she comes at about 53 years old. Excuse me, 63 years old. And she's like the cutest little South Dakota banker's wife ever. She's probably had 1 or 2 glasses of wine a month for 10 years, so not much of a drinker, doesn't use alcohol or doesn't use any kind of illicit drugs, but she's got a big, nice round tummy. She's had high blood pressure. She's got chronic diseases that she comes in to see me. She usually comes in once a year for med refills, but this one she came in because she got written up at work and she wasn't performing very well at work. And she's had the same job for 30 years. These are her friends. This is her community. And she's been missing things at work. Something was wrong with her brain. So it takes a while, but we do several testing, and we do a bunch of other scans, not this one. And before long, it took us a few visits, but I said, this is Alzheimer's. This is early Alzheimer's. And, this was several years ago where I said, I don't have a good answer for you. I can give you meds that will slow things, but to reverse it, I know of one place you could go. And so anyway, they leave the office in tears. They're very upset. And the husband, who is just devastated to say, I can't even think to put her in a nursing home or to find a place for her. There's got to be something we can do. And I said, well, you're going to have to stop your life. You're going to have to not be in your life you got to do it now. This is a big deal. So they actually stopped their life. They actually went to the almond clinic, so good plugs for them. Got put on a ketogenic diet, really, really worked at controlling those blood sugars, and this was her scan 6 months later. And it's the message I was trying to get to this lady, which was really hard to do at church, but was that the brain you have today is not the one that you need forever. That is undoing Alzheimer's. What? She's like, I think, my dad has Alzheimer's and I'm afraid I have the gene for Alzheimer's. And I'm like, then turn off the gene. Stop. Don't be a victim to this. We know the rules that you should start doing in your 40s, 50s, and 60s if your family has Alzheimer's. And that is, we need low blood sugars and we need high ketones. We need low blood sugars, we need higher ketones. And, the first thing that woman had to do was take care of this. I mean, she lost her big fat tummy. And that was through several things that I teach in my clinic, like, jump rope for 1 minute a day and, getting your right brain and your left brain and your limbic system all working at the same time for short amounts of activities, but also 8 hours of sleep. You can't have sleep apnea. And then most importantly, if you really want a brain to work right, you got to feed it right. So the first day I go on a ketogenic diet, I have lots of folks reach out to me saying, I feel terrible. I'm like, I know, it's hard. Switching your body to that ketogenic state is something I write about. There's a stepwise, predictable process that I write about in the book. And it truly helps people to understand this is going to get better. This is going to get better. But the second thing that I encourage patients to do is you should check. You should check to see if you pee ketones. These are super cheap. You buy these little ketone sticks and just prove to yourself that you're peeing ketones, especially for those people just going onto the diet and they say, I tried this before and I just couldn't stick to it. Instant feedback is really powerful, especially when you're trying to change a chronic habit like eating carbs. Today is, 4 days after Thanksgiving. And I've eaten ketogenic since Thursday, but I know I don't feel good, and I was not going to check my blood sugars until today. This brings me to the next thing, which is I wanted to go over, which is what I've heard people be on this ketogenic diet and they got to check all this stuff and look at poke their finger and check their ketones, and you don't have to do that. You can start with checking urine ketone strips. They're cheap, they're easy, there's no poking your finger. It is really not that taxing. However, if you are looking for chronic disease management, like the woman that came to me in church today saying, I think my dad might have this Alzheimer's gene and I'm just hoping my family I didn't pass it on to my family. I'm like, pass them on the education of how to prevent this. And that is, if you want to be a good example, you got to know your number. And I didn't start checking blood sugars for my mom in our story till we were 7 or 8 months into the story. We only used urine ketone strips, and that was good enough for us. We stayed compliant. We had each other as a support. We fell off the wagon, and then we got back on and kind of continued to journey through it. But I would have a different tune now. I would have checked her sugars a lot sooner. Not only does it help the patient understand, it totally changes how you eat. Like today, I like to check my blood sugars and my blood ketones together. So I was getting out, checking, calibrating a machine today, and I checked my blood sugar. It was like 83, and that's a really good blood sugar for me if you've been following me on Instagram. And so I had my afternoon meal, which we have on Sundays, and it was about an hour or maybe 2 hours after that, and I had a blood sugar of 83. Instantly, I thought, oh, I'm doing well. It's that instant feedback for yourself. I've been at this 2 years. I'm a big proponent of this. I really find that when patients understand their own bodies, even if they screw it up, it's one little improvement after another that checking the sugars really does a good job of. I also contend that there are some people who've come to me saying, I can't lose weight, I'm in a plateau, I tried that, it worked for a while, and then I fell off. And one of these, instant feedbacks for people is when you're looking at blood sugars, you can see where your body's at. You can see what that inflammation is. If you follow me on Instagram, I have terrible numbers. I will snack on almonds at the end of the day. I've learned I can't buy them, or I eat the whole bag. Nobody else in the family eats them. I eat them every time. I've learned that macadamia nuts were worse. Yes, they're nice, high fatty nuts, and they are ketogenic, but I eat the whole bag. I'm like, maybe not in one day, but over that week, it's me. I'm the one eating them. So today when I checked my blood sugar, I had a ketone of 0.8, which isn't bad. It's definitely in ketosis. But as I look at how I felt, definitely was still a little bit more like short-tempered and irritable, and like I went to go sit down and read, and I was like, I can't focus very well. And I went back and I had checked my sugar again, and it was up to almost 100. Now, I hadn't eaten anything in there, but it just shows you that dysregulation of my own blood sugar. You think, I'm the doc, I understand how this works, I'm still young. Why would I have a blood sugar that does this? And I would have never believed that it's mine. In fact, one of the things that people have asked me is, which blood sugar monitor do I use? I've gone through several of them, and I found it's really important for me, and especially when they're my patients, for me to trust what the numbers are. So I've been a big fan of the FORACARE. I can put a link in this in the show notes for that. I've had some times where I've checked my number 3 times in a row, and the blood sugar was off by 20 points within 15 seconds. And that is frustrating to me. I finally get patients talked into poking their finger, and they can they're getting me faulty numbers, and it's kind of not, what are you doing it for, right? So I really like their consistency. I've been using that one for about a year, and I use that for my ketone monitor too. So it comes with a ketone and a blood glucose in 1 meter, so that's helpful too. I also think that when it comes to this week, I would encourage you to find an accountability partner. This is the other part that I have tried to create, I would say, work groups for ketones. Your journey for answering to someone, yes, you have a glucose monitor, and if you say, I just don't want to have Alzheimer's, I don't want that to be in my family, one of the best things you can do is check your blood sugars. Make sure that it stays below 100. Sure, if you eat something sugary, it's going to spike them down, but that should be rare, once or twice a month. You shouldn't be eating those things multiple times within your life. If you're stuck, if you've got a weight plateau that you've really been struggling with, check yourself. You don't need a prescription from me. You can push on Google, click, and get it dropped to you. Those are amazing tools that allow you to take control of your healthcare. And you know, the gentleman that I've been praying for with esophageal cancer, I can say that if somebody would have told him, you know, 5 years ago, you're going to have this story, it's going to be hard. It's going to be a very difficult chapter. I mean, he's in the hospital now with a feeding tube and hasn't eaten in 3 weeks. And so you say, gosh, I don't think I can fast for 12 hours, or I can't give up breakfast, or I can't make my coffee black. I would contend that if somebody would have taken him by the hand and said, all right, let's just try to do this for a week. Let's just try to do this for a week. And even if you don't check blood glucoses, again, I don't recommend that you do that until you've got a rhythm of making ketones, peeing ketones. Buy those little urine ketone strips at your pharmacy, put a couple in your pocket, check 2 or 3 times throughout the day for the first 2 weeks. Don't go on to the advanced stuff until you've got a rhythm of making ketones every day before you step into the next one. But I contend if this guy would have had a friend saying, here's what you can do to prevent that, that he would have done it. He would have said, absolutely, I can do this. Let's do it together. And if this woman who's worried about her family getting Alzheimer's says, all right, I read this book and I learned about how this the anti-inflammatory effect, maybe it can help the migraines that she gets. Maybe it helps people concentrate better when they thought that was something only a younger brain could do. Or maybe they get better sleep, they get less depression, they get better cognitive performance. And eventually they get to a pattern where they join us on Sundays and do a 24-hour fast. I mean, I think that's a success. So maybe I'm your only accountability partner right now, but I would encourage you to find somebody, a workmate, a crazy Aunt Hazel, I don't know, somebody who you could do this with, to say, I want to do this, I read this book, and I really think we can all have a healthier life. We have an incredible crisis on our hands. These chronic disease illnesses are taking over our families, and it is the saddest thing to sit in an exam room and watch them say, oh my goodness, the next 2 years, the next 10 years are going to be the hardest to watch what happens when the brain is disconnected from the body. So this is why I'm such a proponent of the ketogenic diet. I think it's a fantastic way to decrease that inflammation, to nourish the body with not just healthy fats, fat. You know, that was the other thing this lady said to me. She's like, isn't that diet where there's like lots of protein and some vegetables? And I said, nope, this is lots of fat. Oh, you mean the healthy fats? I'm like, no, pretty much just fat, like lard. And she looked at me like, you're crazy. Like, no, just go read the book. You'll figure it out. Anyway, so I will go ahead and read your comments as I hop off of this, and I do read them. I appreciate the people who tune in. I've learned that on these videos you can only ask people to do one thing, so I'm not going to ask you to subscribe or do that thing with the bell. I'm not going to ask you to like or Facebook or share. I'm going to ask you one thing, and that is, if you haven't bought the book, it's super helpful for me to hear what you think. I've got people asking me to write another book, and whenever I get down or it's hard, or you kind of say, oh, it's a tough week, and I go read some of the comments about people how I've never met have written and left me a review on Amazon. And as a new author, I don't have a publishing company behind me. I have a mission to say, this is how I help my mom. And I see lots of patients that could have been saved in incredible tragedy. We can undoctor them if we put some science behind why they're doing it, and then create their own little tribe. So if you haven't bought the book, the only thing I'm asking is, if you haven't bought the book, buy the book and then share with what you think about it on an Amazon book review. It's my favorite way to say thank you. All right, that's enough for Sunday night. I am thankful for you guys that tuned in, and I will reply to these comments as soon as I get off. Signing out, Dr. Boz.